Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. Tibiofibular joints. The proximal and distal tibiofibular joints refer to two articulations between the tibia and fibula of the leg. These joints have minimal function in terms of movement but play a greater role in stability and weight bearing. In this video, we shall look at the anatomy of the proximal and distal tibiofibular joints, their structures, neurovascular supply and clinical relevance. Proximal tibiofibular joint. Articulating surfaces. The proximal tibiofibular joint is formed by an articulation between the head of the fibula and the lateral condyle of the tibia. It is a plane-type synovial joint, where the bones to glide over one another to create movement. Supporting structures. The articular surfaces of the proximal tibiofibular joint are lined with hyaline cartilage and contained within a joint capsule. The joint capsule receives additional support from anterior and posterior superior tibiofibular ligaments, span between the fibular head and lateral tibial condyle. Lateral collateral ligament of the knee joint. Biceps femoris, provides reinforcement as it inserts onto the fibular head. Neurovascular supply. The arterial supply to the proximal tibiofibular joint is via the inferior genicular arteries and the anterior tibial recurrent arteries. The joint is innervated by branches of the common fibular nerve and the nerve to the popliteus, a branch of the tibial nerve. Distal tibiofibular joint. Articulating surfaces. The distal inferior tibiofibular joint consists of an articulation between the fibular notch of the distal tibia and the fibula. It is an example of a fibrous joint, where the joint surfaces are bound by tough, fibrous tissue. Supporting structures. The distal tibiofibular joint is supported by interosseous membrane, a fibrous structure spanning the length of the tibia and fibula. Anterior and posterior inferior tibiofibular ligaments. Inferior transverse tibiofibular ligament, a continuation of the posterior inferior tibiofibular ligament. As it is a fibrous joint, the distal tibiofibular joint does not have a joint capsule, only synovial joints have a joint capsule. Neurovascular supply. Arterial supply to the distal tibiofibular joint is via branches of the fibular artery and the anterior and posterior tibial arteries. The nerve supply is derived from the deep peroneal and tibial nerves. Clinical relevance. Dislocation of the proximal tibiofibular joint. A proximal tibiofibular joint dislocation is a rare and often missed diagnosis. It accounts for less than 1% of all knee injuries. The typical mechanism of injury is a fall onto an adducted and flexed knee. They can also occur as a result of high-energy trauma. Common clinical features include inability to weight bear, lateral knee pain and tenderness, prominence of the fibular head. This type of injury is typically treated with a closed reduction. A reduction is a procedure to restore the joint to its natural alignment. Complications of proximal tibiofibular joint dislocation include common fibular nerve injury, the nerve winds around the neck of the fibula, and recurrent dislocation. Now let's have a quiz. 1. What classification is the proximal tibiofibular joint? Fibrous, primary cartilaginous, synovial plane, synovial pivot. The correct answer is synovial plane. 2. Which muscle attaches to the fibular head and provides additional support to the proximal tibiofibular joint? Popliteus, semitendinosus, fibularis longus, biceps femoris. The correct answer is biceps femoris. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.